Yes, hi, Catherine.
Hi, how are you?
It's been a long time now, 2 years, I think,
Yes, it's been very, very, very long.
in the parliament.
Yes, in Parliament, I remember.
And that's the first time I have been in the Norwegian parliament ever. I've been in many African parliaments, but first time in the Norwegian one.
Oh, that's fascinating.
Yeah, so you had to come to Oslo to take me there. So
Okay.
so how is the family?
Oh, they're good, you're good. My baby is now about 2.5. He is a terror in the house. I think you might like him.
And how is the pandemic now affecting your life, the family life in Nairobi?
Well, now we are all working from home. The kids are not going to school, so everybody is at home, which can be fun and can also be a bit chaotic, which is why I'm having this recording in the office. Otherwise, you would see my 2-year-old running up and down this video.
Is the university closed, or you have still students there?
It's closed, but we're having online classes.
How does that go?
It's okay, but it's a bit strange because you can't really tell if the students are listening to you or if they're watching a movie. So it's a bit strange.
Yeah, it must be quite a change, stressful for many, I believe. It's the same here.
Yeah, how are things with you?
We are now in the second lockdown, started a few days back. So we are advised to use home office. Very few people are now here in office, and everything is via the web, online meetings, and so on. But there is no police in the streets, and where you have to show your IDs, as you have seen in South Africa in periods.
Ah.
So we manage quite well, actually, but we have to, in a way, change dramatically our way of interacting with people and so on. So I'm becoming now an expert on webinars, as you know. So
This must be the longest you've been in Norway for a very long time, right?
that's right. I have been in Norway since late February, and that hasn't happened for 30 years. So
Yeah, that's long.
do you hear anything about in the media, for instance, in Nairobi or in Kenya, about the situation in Europe?
No, the only thing we know is mainly, I think France locked down and that Europe, there's a second wave. There's not too much reporting on what's going on in Europe. I think every country is concerned about what's going on in their own country.
And how is it in Nairobi, in Kenya now? How is the situation with the COVID-19?
Well, we seem to be having a second wave as well. So the hospitals are getting packed. It's not nearly as bad as Europe, but you see, with our infrastructure, we can't afford to get to the levels of Europe. But it's getting worse.
It's getting worse. Okay.
Yes, when they opened the country up, people moved to the rural areas. And in the rural areas, everybody thought this was a Nairobi disease. So nobody was taking it seriously. So now it's spread to the rural areas. And I think also the change in weather, because now it's raining, everything combined, it's making things much, much, much worse.
What measures does the government then take to try to restrain the spread of the virus?
Well, for now, all they've done is they've imposed a curfew. So we have a curfew. We all have to be indoors by 10 p.m. It was brought forward. I think before it was 11. Now it's back to 10. They still haven't shut down bars and restaurants. You can still eat in a restaurant. There's not too much that has been done this time around. The first time around, they shut down everything. But this time around, I think that they're trying to be a bit more sympathetic, I think, to the economy, because the economy took a serious beating the last time they did that.
So there are travel restrictions, you say, also inside the country?
Not really. It's just the timings. You can travel in and out of Nairobi and to the other counties, but they've restricted the timings for travel. The explanation I got was that people tend to flout the transportation rules more in the evenings. Because what they've done is that they've limited the number of people who can be in public transport at the same time. So they say by evening, the later it gets in the day, the worse compliance there is with the travel rules.
You say the economy took a big hit when the virus started to spread in March, April. What is the situation now with respect to jobs and business environment in general?
Yeah, quite a number of people lost their jobs. Different sectors took different hits depending. Like banking, for example, took a hit, mainly because the people who they'd lent money to were defaulting because they couldn't pay their debts. And unlike what they did in Europe, where they offered people a moratorium, they didn't really offer that kind of moratorium. They said you can come and we discuss. So there wasn't really a moratorium of that sort. So the banking sector has taken a hit because people are not repaying their debts. And so now they don't want to lend money to the few who still need the money. So you sort of have a lot of liquidity amongst the banks, but they're not lending the money to anybody. Then I think the entertainment sector took quite a hit, quite a hit. So which impacted the media houses. So they ended up laying off quite a number of people. Lawyers, of course, we've been hit very badly because nobody needs a lawyer when you're not working. So if other businesses are not working, nobody needs us. So we took quite a hit. Quite a number of lawyers took a hit. I think the people who are making money are probably hospitals, the private hospitals, and maybe the people who are selling data. If you deal telecommunications, they are the ones making all the money because all we do is have webinars all day.
What about the tourism sector?
Oh yeah, that took a serious hit because first of all the flights were cancelled, so nobody was coming in. Tourism took a serious hit.
And you mentioned that now after the second wave, then the government have focused more on how to revitalize the economy. What specific measures have the government taken to support the private sector then, on businesses? Has they done anything on taxation, for instance, or other incentives?
So what they did with taxation was that they reduced the rates of tax for both corporations and for individuals. Then they also introduced, they sort of widened the scope for presumption tax, for a presumptive tax. We normally have sort of like a turnover tax, but it's not applicable to companies. It's normally applicable to individuals. And then they had a very, very low threshold for it. So what they did was that they expanded the threshold from 5 million to 50 million. And then they also expanded its applicability to not just individuals, but now also companies can benefit from it. So now you don't necessarily have to pay tax at the normal 25% if you're a company. Now you can opt to pay the 1% of your turnover. So they reduced the tax rates for everybody. They also reduced, I think, VAT from 16% to 14%. They did a number of things.
And these measures, are they temporarily, or do you think they will stay on?
Well, from what the president said the last time he spoke on it, it seems to be a very temporary measure. It appears they will be repealed come January 1st, but there's no official communication on it. But that's the suspicion.
No, because normally it's easier for politicians to reduce the rates than increase rates. But in a situation where you have where the economy is in trouble, I assume also that the public debt is quite high. So there is kind of this dilemmas, I assume, for politicians. They need to stimulate the economy using the tax system, and at the same time they need revenues to pay for the debt. So these are very problematic choices, I assume.
It is. It's a very problematic choice, and our debt, as you said, is shockingly high. So sort of what they did was that they reduced the rates, but at the same time they clawed back on quite a number of the incentives that they offer corporations. So quite a number of those incentives and exemptions under the VAT Act were removed so that, I'm assuming, so that at least they could make some money.
And what is the business or private sector reactions to the government measure? Do they find them sufficient or satisfactory, or are there a lot of complaints?
It depends on the side that you speak to. So some people think that it's enough, especially like the companies that were able to take advantage of the new turnover system. Then you have the bigger companies who are enjoying incentives, and these have been taken away from them, and so they're not happy about it. So you sort of have like a mixed bag. Nobody is very excited. Individuals are happy because our tax rate now is much lower. We're very happy about that. But generally, it's sort of like a mixed bag. Nobody really thinks that everybody thinks that the government could have done a much better job. They opted to do things like invest in roads. So everyone is like, we don't need roads during COVID. What we need is something that will put money in our pockets. So there's sort of that divide amongst the people.
And is there any kind of joint efforts within the East African community on these issues, or do each country implement its own policies or measures here?
Everybody's implementing their own measures. I mean, you have Tanzania, which says COVID doesn't exist. Yeah. Then you have Uganda and Rwanda, which went on like a serious lockdown. So we are all sort of, I think it was every man for himself and God for us all. So everybody just opted to do what they could and what they thought was best for them under the circumstances. So there's no coordinated effort. Yeah. Though I think it will have to come.
Now, I'm just wondering whether there is any discussion in the media or among people about Tanzania in this context, because Tanzania seems to be an outlier where they haven't put in place almost any measure, and there are only about 500 registered people who have been registered cases and very few deaths. How is that? Is there anything mentioned about that in Kenya?
No, nobody's talking about Tanzania. Tanzania it's quiet. They had elections recently, so, and you know how elections get in Africa. You've been here, so you know. So no one is talking about it. There are rumors that things are bad, but there are no confirmations.
So now it's Kenyans focus on Kenya cases and Ugandans on Ugandans. There is not kind of an East African kind of joint spirit here.
No, but as you can imagine, it's going to cause problems once COVID is over, because Kenya can't have a much lower tax rate than everybody else. So I'm sure we'll all have to get back to the table to discuss it.
And do people expect here that this will last, or is there any kind of optimism now after there seems to have been discovered a vaccine that might work?
I think the thing with Africans is that we're so used to having diseases. We think this is just one more that we'll need to deal with. I don't know if people are very optimistic so much about a vaccine. I think people are just trying to figure out, okay, so we have this new disease, so how do we learn to live with it? I haven't had too much optimism, about a vaccine. It's more people trying to figure out, okay, so how do we get a control of this virus?
So when you compare Kenya with some European countries, the number of cases, people infected positively, is very low compared to the size of the population, and this number of deaths also very low. Is there any discussion on how that can be explained? Why the Western countries has been so much more seriously affected compared to many African countries?
I don't know. The only explanations I've had from some doctors is that they keep saying we have a much younger population, and also we spend a very, very large part of our day outside. So we are always outside, and our weather, of course, is much better than the weather in Europe. So they keep saying those factors come into play. And of course, there's all the Africans keep saying, finally we get to survive something that the rest of the world does not. So no one really knows. Yeah.
No, let's hope that that things will improve soon. And then when it comes to the economy again, this has affected, as you say, Kenya very seriously. Both public revenues, the public sector in general, but also private sector not least, and they are so mutually dependent on each other. Do you think that there will come something good out of the pandemic in the way that the public sector and the private sector now realizes that actually they are mutually dependent on each other, so they can establish more constructive discussions on policies and come up to more consensus policy? Or is that just a dream?
Right now, it sounds like a dream, but I am not sure. I'm trying to think if there's been any concerted efforts from both sides of the divide. Right now, I think everybody is just trying to survive right now, honestly. The private sector is trying to survive. They have been trying to reach out to the government to put in measures, but I think we're still at the point of the private sector is trying to survive. The government is trying to hold everything together. Whether something positive may come out, maybe.
Yeah.
I don't know.
And what about the opposition here? Is that the opposition in the parliament? Are they in general supportive to the policy measures by the government, or are there a lot of conflicts there also?
So something very interesting happened in our politics recently. The leader of the opposition sort of got into an agreement with the government, a political agreement with the government. So I'm not sure we have like an official opposition, but then again, the deputy president fell out with the president, so maybe now his side is the opposition. So we don't really have a proper opposition right now. So it's very hard to tell if things are being fought for the sake of accountability or if it's just a political battle. But also, Parliament has not been very active during this period.
So what do you think now is the way back to recovery for Kenya? Do you see any kind of a light at the end of the tunnel here?
I think there is. There's definitely going to be a light at the end of the tunnel. Businesses are beginning to open up. Things are beginning to look up a bit more. The people who had completely hunkered down, because what had happened as well was that anyone who wanted to start a new project had stalled and they were not even thinking about it. So I've seen those people come out and now projects are beginning to start. You can see construction going on. So there's hope. There's definitely light at the end of the tunnel. It's not gloom and doom. No. Things will definitely look up, I have no doubt. The government just needs to play its cards well in terms of knowing how to stimulate the economy. Like, I do not think that rolling back the taxes early next year would be a wise thing, because a lot of the people who had a very bad year this year will spend the next year or two trying to recover. So when you increase the tax rates, you will not be helping.
Is there any specific things you think Europe could learn from the experiences from Kenya or other African countries in this situation?
I think, well, not from a tax perspective, but I think mainly from a medical perspective. Maybe community health workers help quite a bit. It does help that I think we've had very many contagious diseases before. So when you tell people the measures that they should take to protect themselves against like a contagious disease, it's not entirely a shock to us. But that's also because we have a lot of, what do you call it? It's not even subliminal education, but we're constantly being bombarded with information, like about TB, for example. We constantly have adverts on the TV constantly telling us that TB has a cure, don't suffer in silence, do this. Then we have health workers who follow up anyone who's diagnosed with TB, and they make sure that they are treated. So because we have that kind of a network, it has helped somewhat. Not entirely, because our infrastructure is still very poor. But I think if we didn't have that rudimentary structure, I think for sure would have collapsed. And I think that's something that Europe can benefit from, because you guys have the big infrastructure, but a lot of the things could be caught at the lower levels.
And when it comes to research now, is there any active research on the COVID, the experiences so far, what measures and policy measures can be taken to when one is moving forward, the post-COVID situation? At your university, for instance, are there people who have started to do research in this area?
I haven't heard of any yet. No, I haven't heard of any yet. Yeah.
So maybe there are still a lot of options and areas where we can continue to work together on tax then.
Yes, by all means, by all means. Are you doing research on the area?
Yes, I do a lot of work on this now, and I'm doing a study for Danida on issues of taxation and effects of the tax systems of the COVID in Africa. So.
Oh, which countries are you covering?
No, we are covering, including Kenya actually, because they are the priority. Kenya is one of the priority countries for Denmark. So it's a kind of a desk study. So hopefully it can at least come up with some advice.
Yeah, I hope so.
Yeah. Are you going back home now after this talk to the family and the baby?
Yes, I'm going back to my chaotic house, yes.
So, Catherine, thank you so much for this conversation. It was a real pleasure meeting you again online, but this is the new reality where we will continue to meet for a while, I assume. It was very nice talking with you, and thank you very much for sharing your insights on the situation in Kenya. So you must forward my best regards to your family, and I look very much forward to seeing you again. Take care, stay well and healthy. Bye-bye.
All right, thank you, Odd. Bye-bye.